There's a huge disparity in terms of research for women with Parkinson's disease. Most people, have this idea that Parkinson's disease is an older gentleman with a shaky tremor, affects all genders, races, ages.
At Roche, we are right now working on a digital solution that is called Floodlight MS. And basically the aim of this smartphone-based application is to help people living with MS, but also their neurologists to better track the unique disease activity of that specific person.
Involve the partners, because they are the ones who are closest to you when you're going through something like this, and involve the partners, involve the healthcare professionals, and also involve midwives and other individuals who are close to the women who are experiencing perinatal depression and anxiety. Usually the partners are usually the environment around women at this stage. They can be more of helps.
What we noticed with our app, with the data which we retrieve from the app, is that there is some difference in I wanted to say performance, but in how in the metrics we observe from our app when we let a male or female do it, or we let a younger or an older person do it, that we could differentiate between male and female using our app, which tells us that there is quite a significance in this data in allow us to differentiate between male and female, but it would also maybe allow us in the future to go, for example, into target medicine.
There is a high engagement with digital solutions during this period, which has been reported as well in literature. And the second point, in terms of gender differences, so one of the things that we are now in the second phase of the app planning to do is to create solutions which can predict perinatal depression earlier than the self-reported questionnaires that we usually use.
We have to go back to looking at the whole of society, and where do we begin? Prevention of disease should become part of the future design of health systems. I think in the past we've designed health systems more as sort of sickness management systems than of health systems per se, and I think this needs to make us broaden our thinking out from what would be traditional healthcare.
A massive knowledge challenge. And we know this from the numbers as well, that 1 out of 4 patients only get diagnosed with dementia, where we see that females usually get diagnosed in primary care already, whereas males get transferred to specialist care, where they usually tend to get better assessments and higher quality in the diagnostics as well.
One of the main things from a technology or a data science standpoint is the size of the data sets, right? The more people that use these digital technologies, the larger the data sets become, and then therefore the algorithms become better over time.
We need people to amplify the voices of people with Parkinson's